New Year means a lot of new laws going into effect across the country, including one that puts a ban on something that impacts and shocks millions of Americans every year.
Yes, we're talking about surprise medical bills. Reporter Ali Vitale has what you need to know.
In the middle of the night on April 20th, Stacy Jackson heard a knock.
There was a deputy at the door, and he said that the only thing he knew was that my son had been shot in the abdomen.
Her son's injuries were thankfully not severe enough to warrant surgery, and he soon went home to recover. But then came the bills. The helicopter ride to the hospital alone cost more than $26,000.
I thought, surely this isn't possible.
Stacy is one of the millions of Americans stunned by surprise medical bills every year from doctors or services outside their network. But starting today, a new law makes that a thing of the past.
This is a change that needed to happen, and this really should benefit patients.
The No Surprises Act means Americans will no longer have to worry about unforeseen fees when seeking medical care, including for air transport to hospitals. Patients will still be required to pay their deductibles, but won't receive extra bills from out-of-network providers, who will resolve any claims directly with insurance companies. Any unresolved disputes can be handled through an independent resolution process, with a new online complaint system already live. And providers could now be fined up to $10,000 for wrongful billing. Nevertheless, experts say patients still need to be vigilant.
If you think it's too much, I think the first call is to whomever sent you the bill and just tell them, I think this is the wrong amount. I want this to be corrected.
For Stacy, whose charges were ultimately settled after more than 7 months of negotiations, these changes are reassuring, especially during the pandemic, with unexpected medical crises now all too common.
I think this bill is a great thing because this isn't a situation that's unique. This happens to people every day.
Ali Vitale, NBC News.